I did a video a couple months ago on using human chorionic gonadotropin or HCG drops, homeopathic drops, for fat burning. And if you're trying to lose weight with some dietary modifications, HCG seems to help reduce your appetite, and it helps you mobilize fat and burn it. So, several of you, quite a few of you actually, ordered those drops. Here they are. HCG drops, homeopathic version. HCG is an infertility medication used for stimulating ovulation in women that are undergoing ovulation induction cycles, but it's been used for many years in weight management, and the FDA hates it. But here is a follow-up from one of you without using her name and how she's done using HCG. And she was mainly for fat burning, but here's what she said. I got to read it to you. I just wanted to give you some feedback on my progress. It's all fantastic. I was given the catch-all diagnosis of fibromyalgia around 25 years ago. I have been on every different medication out there, none of which has helped. She switched from krill oil to krill oil from omega-3s, trying to get rid of some bone pain, so that's not a quote, and then back to her. Now that I started taking the HCG, my deep bone pain is just about gone. Maybe it's just a fluke, but for the past full week, I feel like I'm alive again. I'm hoping this continues. I just had to let you know. Does this make sense? Well, it makes sense to me, and it makes sense to some other doctors, and let me show you why. This is an article from Practical Pain Management. It's actually back in 2011 for using HCG in pain treatment. And this MD PhD here listed makes an argument for using low-dose HCG as an injection as part of a pain management protocol since it's so safe. And I'll let you pause and read this one. It's hard to see the entire link. But this is a follow-up from 2019, Practical Pain Management from the same doctor on human chorionic gonadotropin and how it's being used for chronic pain management. So I'll quit moving the phone so you can screenshot it or pause and read that. And this is an article from Vitality 101, Dr. Jacob Teitelbaum, on HCG, a new pain therapy breakthrough. And he specifically talks about patients with fibromyalgia, or in general, just chronic pain syndrome. So Dr. Teitelbaum goes on to say that he doesn't see this as a first-line therapy, but there are apparently only 3 FDA-approved medications for fibromyalgia, and this is a low-cost version that would be more cost-effective, especially if it works. And from my review, HCG improves pain levels in fibromyalgia patients in about 50 to 60% of those patients, and it's pretty quick. So this young lady that sent me that email, she only had a 30 days, no, she got 2 bottles, so a 60-day supply, and that's about 3 weeks in, and her fibromyalgia pain is gone. So, we'll do a whole series on hormone therapy for chronic pain syndrome coming up here in the next week, so that you can see that there are alternatives to all the pain meds and opiates and all the things that you hear about that are so scary and dangerous. If they're used properly, they're not, but you do have options with hormones. The problem is most doctors don't know anything about hormone therapy for pain management, despite all the research showing that it is effective. And I was a hormone doctor for 30 years. I think hormones are it. If you can balance those, you've got a good basis for better health. Talk to you soon. See ya. Bye.